Welcome to my channel, Chemo Pharmacology 101. My name is Lisa, and I am a board-certified oncology pharmacist. Today, we will be talking about asparaginase. As a refresher, the cell cycle is important to keep in mind when learning about chemotherapy drugs. During the G0 phase, the cell rests and cells are not actively dividing. During the G1 phase, or the gap1 phase, the cell grows and increases in size to ready for DNA synthesis. During the S phase, DNA replicates to prepare for cell division. During the G2 phase, the cell grows again and increases in size to prepare for division, which occurs during metaphase. Asparaginase acts on cells in the G1 phase. Asparaginase products target cells that are unable to synthesize asparagine. Asparagine is an essential amino acid. Normal cells have adequate asparagine synthetase, whereas ALL or acute lymphoblastic leukemia cells do not. Asparaginase products deaminate L-asparagine to ammonia and aspartic acid, which deprives tumor cells of the essential amino acid asparagine. There are 3 formulations of asparaginase, including asparaginase, PEG asparagase, and Cal asparagase. Asparaginase Erwinia chrysanthemi is an FDA-approved product for pediatric and adult patients who have developed hypersensitivity to E. coli-derived asparaginase products. It is an intramuscular injection. 6 doses of asparaginase are equivalent to a single dose of pegylated asparaginase. It is dosed every 48 hours or on a Monday, Wednesday, Friday schedule. PEG asparagase is an FDA-approved product for both pediatric and adult patients who have developed hypersensitivity to asparaginase products. It is a pegylated product and it is E. coli derived. It is thought that it carries a slightly lower risk of hypersensitivity reaction than regular asparaginase products because it is pegylated. However, about 30% of patients will still react to pegylated products. It is administered either intravenously or intramuscularly, and it should not be given more frequently than every 14 days. Cal asparagase is an FDA-approved product for pediatric and young adult patients who have developed hypersensitivity to asparaginase products. It is also a pegylated and E. coli-derived product. It is administered intravenously and should not be given more frequently than every 21 days. Given its high risk of hypersensitivity reaction, pre-medications are required. It is required to give acetaminophen, an H1 receptor antagonist such as diphenhydramine, and H2 receptor antagonists such as famotidine 30 to 60 minutes before each dose. It is expected that asparaginase is catabolized into small peptides. The half-life of pegylated products is longer, about 5+ days versus 16 hours with non-pegylated products. There are several adverse events that is important to monitor for after asparaginase administration. It carries a risk of pancreatitis, so it is important to monitor the patient clinically for signs of pancreatitis, as well as monitor amylase and lipase periodically or when clinically warranted. It does carry a risk of both hemorrhage and thrombosis, so it is recommended to transfuse cryoprecipitate as needed for hypofibrinogenemia in the event of procedures or bleeding events. To prevent thrombosis, it is recommended to monitor antithrombin 3 activity levels and administer antithrombin 3 as needed to maintain activity. If a blood clot develops, it is recommended to give the patient therapeutic anticoagulation. It is also recommended to avoid other hepatotoxic medications because there is a risk of hepatotoxicity with asparaginase. And in the event of elevated blood glucose or hypertriglyceridemia, it may be necessary to treat patients for these. Because asparaginase products are used to treat ALL, and several ALL regimens include a medication called methotrexate, there is one very important drug interaction to keep in mind. If asparaginase and methotrexate are given together during the same cycle of therapy, it is recommended to give methotrexate before administering asparaginase. If given before methotrexate, asparaginase can deplete glutamine and reduce the formation of antifolate polyglutamates and reduce the efficacy of methotrexate. Thank you for watching. If you have any questions for me, I will do my best to answer them in the comments below.